So why do we do diagnostic testing? There's a lot we can see with an exam, but when we want to get baseline numbers on your functioning of your brain, then we need to do diagnostic testing. So we do a QEEG, which is a cap on your head, and we look at 4 brain waves, and we see if the areas of the brain are communicating properly or they're communicating improperly. There's other tests that may be important for you to understand your function. One of the tests is called a CAPS test, a test that tests balance, either on a hard plate or a pillow plate. And so we get tremendous amount of information. We can do what's called a neuroline. A neuroline is to see if the eyes are aligned. Are they moving together? Are they moving too slow, too fast? The next test that we would do would be a right eye test. Similar to the neuroline, but we can get detailed information about the functioning of the eyes as far as movement is concerned, but also a reading test. When you read, you do work. If your eyes aren't aligned, if they're not moving properly, then you're not going to read a line as efficiently as you should. And if you're not, then it's a lot of strain on the eyes. People can get headaches, they can get brain fog when they read. There isn't any job that you can get today that you don't have to read. The last test that we can do is called a vital scan. Now, it's a very complicated test. It's an EKG, blood pressure on the arm, and pulse ox on your finger, blood pressure on both legs, and pulse ox on your toes, so that we can look at your autonomic nervous system. So the diagnosis that a lot of our patients get is called POTS, and that's where your heart rate goes up too fast, you don't breathe right. And then tests that test cognitive would be our CREYOS test. It used to be called the Cambridge Brain Science test. We look at 12 areas of cognitive processing that are related to different areas of the brain. Those tests are very, very important for us to understand how your neurology is functioning. The last part of it is functional medicine diagnostics. We want to look at food sensitivity. We do a blood test for that. It's an IgG antibody we look at against different foods. We do an IgG antibody against mold. We do 14 molds that we screen for. Heavy metals, very, very important. Lead, aluminum, mercury, cadmium, things like that can stress the body, but also stress the brain. And then we do a stool test. A stool test will really tell us a lot about either good or bad bacteria, whether you're digesting properly. The last test that we usually do is we want to look at cortisol. We can do another test for cortisol with your sugar handling or your metabolic state for sugar. And that really gives a picture for patients that have been through the gamut of therapies, and they're saying, I'm not back where I want to be. I've had some success, but I'm not where I should be. I don't have my life back. I still have problems with work, with relationships. I still have problems doing the hobbies I used to do or the enjoyment I had in my life. So that's essentially how we do diagnostics and why we do diagnostics. And I invite you to really take a look at our center as something different that you would find anywhere else. I've been doing this for 35 years. I like to say I'm not as old as I am, but I am. And with age comes wisdom. If you have questions when you're in the office, we go back to the diagnostics, we go back to your examination, and then we work it through as we go along. So thank you very much. I'd love to see you in the office for us to do an evaluation of you and our diagnostics.